Hello everyone and welcome to Module 6 of the NACC-PSW certification exam. Module 6 focuses on household management, nutrition and hydration. So we're going to dive right into the questions. Question 1. When the body does not get the amount of water it requires, the major concern is A. Edema, B. Output, C. Expiration, D. Dehydration. Edema refers to a swelling that is caused by excess fluid in the tissues. Output refers to the amount of urine or bodily fluids being excreted. However, it is not the major concern when the body lacks water. Expiration is the process of exhaling air from the lungs, and this is unrelated to water intake. While dehydration occurs when the body does not have enough water to carry out its normal functions. So we're going to go with option D. Dehydration leads to serious health issues like impaired kidney function, reduced circulation, and electrolyte imbalances. Question 2. Which statement about Canadian home care programs is correct? A. Hospital care is cheaper and a better alternative for most people. B. All home care is free to Canadians. C. Provincial government funding is shifting to home care. D. All provinces and territories govern their programs in a similar manner. Option A is incorrect because hospital care is generally more expensive than home care. Hospitals provide acute round-the-clock care, and this incurs higher costs. Home care, on the other hand, is seen as a cost-effective alternative for managing chronic conditions or providing support for individuals who do not require intensive medical interventions. Option B is also incorrect because not all home care services are free. While publicly funded programs exist, they are subject to provincial regulations and they may have limitations based on needs, income, or service availability. Some services might even require out-of-pocket payments or private insurance coverage. In option C, provincial and territorial governments manage home care programs in Canada, but these services are not covered under the Canada Health Act in the same way as hospitals or physician services. So funding and priorities have been gradually shifting towards home care in order to support aging populations and to reduce the reliance on hospitals and long-term care facilities. In option D, this would be incorrect because each province and territory in Canada has the autonomy to govern and implement its own home care programs differently. So with respect to what we have here, the statement that is correct about Canadian home care programs is option C. Provincial government funding is shifting to home care. Home care services vary across provinces and many of them are not entirely free because some costs might still be borne by the individual based on their income or their needs. Question 3. When preparing a meal for a client with a heart condition, you would include A. Shellfish, rice, homogenized milk. B. Pasta, fruits, ice cream, eggs. C. Skim milk, vegetables, lean meat. D. Cottage cheese, bread, liver. In option A, shellfish, rice, and homogenized milk is not the ideal meal to prepare for a patient or a client with a heart condition. Shellfish can be high in cholesterol and homogenized milk contains higher fat levels compared to skim milk. So this is not ideal for a heart-healthy diet. In option B, ice cream contains high levels of sugar and fat and these are not healthy for the heart. Eggs should also be eaten in moderation due to their cholesterol content. For option C, skim milk is lower in fat compared to whole milk, and this will help to reduce the intake of saturated fats, which usually contributes to heart diseases. Vegetables are high in fiber, vitamins, and minerals, and they are also beneficial to heart health. Lean meat is a low-fat source of protein, and we have various types like lean cuts of chicken, turkey, or fish. These are recommended over fatty meals because it will help to reduce the saturated fat intake. In option D, liver can be high in cholesterol, and some types of cottage cheese are also high in fat. So this combination is not the best choice for someone with a heart condition. So we'll be going with option C. For someone with a heart condition, you would include skim milk, vegetables, and lean meats. Question 4. Which one of the following identifies common uses for bleach in the home? A. Scrubbing floors and windows. B. Whitening and disinfecting. C. Cleaning toilets and laundering colored towels. D. Bleach is not used in the home. In option A, while bleach can be used to sanitize floors, it is not typically used for scrubbing or cleaning windows due to the risk of damage to certain surfaces. Bleach is commonly used in the home for its ability to whiten fabrics and to also disinfect surfaces. It is also highly effective at killing germs, bacteria, and viruses, and this makes it suitable for sanitizing high-touch areas like the kitchen and bathroom surfaces, as well as for disinfecting utensils and tools. Bleach is suitable for cleaning toilets in option C. However, it is not ideal for laundering colored towels because it can fade or damage their color. Option D is incorrect because bleach is a widely used household cleansing and disinfecting agent. So our answer here is option B. The common use of bleach in the home is for whitening and disinfecting. Question 5. Discomfort and or difficulty in swallowing is referred to as A. Paraplegia, B. Aphasia, C. Quadriplegia, D. Dysphagia. Paraplegia is the paralysis of the lower half of the body, and this is usually due to a spinal cord injury. Aphasia is a language disorder that affects a person's ability to speak or understand speech. This usually happens due to brain damage, like for instance, after a stroke. Quadriplegia is the paralysis of the four limbs, and this is often caused by a spinal cord injury or other neurological conditions. Dysphagia refers to difficulty or discomfort in swallowing, and this can occur due to various medical conditions like neurological disorders or a stroke. So our answer here is option D, dysphagia. Question 6. Which action is correct when bottle feeding a baby? A. Burp the baby every 10 minutes. B. Hold the baby close to your body and relax. C. Lay the baby down and prop the bottle. D. Leave the baby alone with the bottle. When bottle feeding a baby, the following actions are very important for safety and bonding, and also comfort. First, you have to hold the baby securely and close to your body. This will provide physical support and comfort, and also ensure that the baby is in an upright or semi-upright position to reduce the risk of choking or ear infections. Also, you have to maintain eye contact and relax, because this will foster an emotional connection and help you to monitor the baby's feeding behavior. So given the options we have here, the answer would be option B. Hold the baby close to your body and relax. Question 7. When preparing a meal for a client that is allergic to wheat, you would avoid serving A. Eggs and bacon, B. Ham and bean soup, C. Toast and butter, D. Cottage cheese and peaches. Eggs and bacon do not contain wheat, so they are safe for someone that has a wheat allergy. Ham and beans also do not contain wheat unless they were processed with wheat-based ingredients, but generally they will be safe to prepare for a client that is allergic to wheat. Toast and butter, while butter is not made from wheat, toast is made from wheat bread, so this should be avoided for someone with a wheat allergy. Cottage cheese and peaches are also free from wheat, so this can be served to a client that is allergic to wheat. So given the options we have, what you should avoid serving a client that is allergic to wheat is option C, toast and butter. Question 8. An item commonly found in the home that can be substituted for a non-abrasive cleaner is A. Table salt, B. Vinegar, C. Baking soda, D. Rubbing alcohol. While salt can be abrasive, it is often used in some cleaning tasks. However, it is not considered a non-abrasive cleaner. Vinegar is a good cleaner, but it can be acidic and may not be considered as non-abrasive, especially for delicate surfaces. Baking soda is a non-abrasive, effective cleaner that is commonly found in the home. It can be used to clean various surfaces like the kitchen counters and sink, and it is safe for almost all types of surfaces. Rubbing alcohol is used for disinfecting and it can be harsh, so this is not a non-abrasive cleaner. Given the options we have, the non-abrasive cleaner we have there is option C, baking soda. Question 9. One of the major focuses of home care is to A. Provide accommodation for acutely ill people who do not want to go into the hospital. B. Enable clients remain in their own homes. C. Diagnose and treat disease. D. Provide accommodation to people with disabilities. Given the options we have here, one of the primary focuses of home care is to support individuals in maintaining their independence and staying in their own homes for as long as possible. So home care provides various services like personal care, therapy, medical assistance, and household support, because this allows the clients to live comfortably in familiar surroundings while managing chronic conditions, recovering from illness, or receiving palliative care. So our answer here is option B. The focus of home care is to enable the clients to remain in their own homes. Question 10. When the number of calories ingested is insufficient for the client's basal metabolic rate, the client will A. Sleep more, B. Lose weight, C. Gain weight, D. Develop anorexia. If the number of calories ingested is insufficient to meet the body's basal metabolic rate, the body will begin to use the stored energy, and this is typically in the form of fat and muscle tissue, to meet its energy needs. This will result in weight loss. So our answer here is option B. For option A, insufficient calories do not cause an increase in sleep. In fact, it may lead to fatigue, and this does not necessarily mean more sleep. For option C, gaining weight requires a surplus of calories and not a deficiency. While in option D, anorexia is an eating disorder that is characterized by an extreme fear of gaining weight and restricted eating. but insufficient calories alone will not cause anorexia. So our answer here is option B. When the number of calories ingested is insufficient for the client's basal metabolic rate, the client will lose weight. Question 11. The GI system is also known as the A. Trachea, B. Alimentary canal, C. Bowel, D. Peristalsis. The trachea is the windpipe and it is part of the respiratory system and not the digestive system. The alimentary canal, also known as the GI system or the gastrointestinal system, is a continuous tube that runs from the mouth to the anus, and it is responsible for the digestion and absorption of food. Bile is a digestive fluid produced by the liver to help break down fats, but this is not the name of the system itself. Peristalsis is the wave-like muscle contractions that moves food through the digestive tract. So our answer here is option B. The GI system or gastrointestinal system is also known as the alimentary canal. Question 12. Home care services provided by the support worker might include A. Respiratory therapy, B. Assisting the clients with banking, C. Vacuuming and dusting, D. Assisting the clients with physiotherapy. Respiratory therapy is performed by a trained healthcare professional like a respiratory therapist, but not a support worker, because this involves specialized skills and medical training beyond the scope of a personal support worker. Financial tasks such as banking are not within the typical responsibilities of a personal support worker, because personal support workers focus on personal care and home support. Moreover, assisting with banking could raise issues of trust and liability. Home care services provided by support workers such as the personal support worker usually include light housekeeping tasks like vacuuming and dusting. These services help to maintain a clean and safe living environment for the clients who may not be able to perform this task on their own due to physical or medical limitations. For option D, while a support worker might assist with exercises prescribed by a physiotherapist, the actual therapy is carried out by a licensed physiotherapist or rehabilitation professional. Support workers can help the client to follow the recommendation. However, they do not provide direct physiotherapy. Our answer here is option C. Some of the typical tasks that the personal support worker does in home care is assisting with personal care like bathing, dressing and grooming, doing some light housekeeping like vacuuming, dusting and laundry, meal preparation and grocery shopping, assisting with mobility and transferring, as well as providing companionship and emotional support. Question 13. According to Canada's Food Guide to Healthy Eating, pregnant or breastfeeding women need to increase their intake of one of the four food groups. A. 3 to 4 servings milk group. B. 2 to 3 servings milk group. C. 3 to 5 servings meat group. D. 4 to 6 servings fruit group. Canada's Food Guide recommends that pregnant or breastfeeding women increase their intake of the foods from the milk and alternatives group, because these will provide the essential nutrients like calcium and vitamin D, which are crucial for fetal and infant bone development and the overall maternal health. So our answer here is option A. But let's also take a look at the other options. In option B, 2 to 3 servings milk group is insufficient to meet the increased calcium and vitamin D needed during pregnancy or breastfeeding. For option C, while protein and iron from the meat and alternatives group are essential during pregnancy and breastfeeding, The focus on increased serving is specific to the milk and alternatives group. Option D, the 46 servings of fruit group is an unrealistic number and it is not reflective of any recommendations in Canada's food guide. Fruits are important for vitamins and fiber, but their intake does not need to be increased to this level. The recommended nutritional adjustments for pregnant and breastfeeding women are calcium and vitamin D, which can be found in milk, yogurt, and fortified alternatives, folate, which can be found in leafy greens, fortified cereals, and legumes to support fetal development, iron and protein, which can be found in meats, legumes, and eggs for oxygen transport and growth, as well as omega-3 fatty acids found in fish and nuts for brain and eye development. This guidance supports the health of both the mother and the developing baby. So it is important to always consult healthcare professionals for personalized dietary advice during pregnancy or breastfeeding. Question 14. To ensure safe storage and handling of food, the caregiver should A. Leave pork on the counter to thaw. B. Store all foods at room temperature. C. Wipe countertops with cold water after use. D. Wash their hands before handling the client's food. In option A, pork or other types of meat should not be left out at room temperature to thaw because this can promote bacterial growth. They should be thawed in the refrigerator or in cold water. Storing food at room temperature can lead to the growth of bacteria, especially in perishable items like dairy, meat, and cooked foods. These should be stored at the appropriate temperatures. For option C, wiping the countertops with cold water is not really effective. It is recommended to wipe with warm and soapy water in order to properly sanitize them. Cold water is ineffective at removing germs and bacteria. Given the options we have, we'll be going with option D. To ensure the safe storage and handling of food, it is essential to follow proper hygiene practices like washing hands before handling food. This will help to prevent contamination and the spread of harmful bacteria that can cause foodborne illnesses. Question 15. According to Canada's food guide, one adult serving of juice equals A. 125 ml, B. 250 ml, C. 375 ml, D. 500 ml. According to Canada's food guide, one serving of juice for adults equals 125 ml or half a cup. While 100% fruit juice can be part of a healthy diet, the guide emphasizes that whole fruits and vegetables are preferred because they provide more fiber and nutrients. So juice should be consumed in moderation due to its high sugar content. The other options, 250 ml is twice the recommended serving, 375 ml is 3 times the recommended serving, and it exceeds the guideline for moderate consumption. While 500 ml is half a liter of juice, and this is significantly more than the recommended portion. This could contribute to excessive sugar intake without the fiber and benefits of whole fruits. So that's why we're going with option A. That is the recommended serving of juice for an adult, according to Canada's food guide. Question 16. When preparing a meal for a client with an allergy to wheat, you should avoid serving A. Ham and bean soup, B. Eggs and bacon, C. Cottage cheese and peaches, D. Toast and butter. For this, we'll be going with option D. I think we've talked about this one before, so we'll just move on to question 17. What is an example of a carbohydrate? A. Yogurt, B. Rice, C. Cheese, D. Peanut butter. Carbohydrates are one of the main types of macronutrients, and they are found in foods like grains, fruits, vegetables, and legumes. Given the options we have, Rice is a high carbohydrate food and it is specifically a source of complex carbohydrates. Yogurt may contain some carbohydrates, mainly lactose, but it is also high in protein and fats. Cheese is primarily a source of protein and fats with very little carbohydrate content, while peanut butter contains mainly fats and proteins. It does contain some carbohydrates, but it is not considered a significant source of carbs. So our answer here is option B, rice. Question 18. The reason for a scent-free policy is to ensure no one has a breathing issue or allergic reactions caused by a scent. True or false? This statement is true. A scent-free policy is implemented in order to create a safe and healthy environment, especially for individuals that may have respiratory issues, allergies, or sensitivities to scents. Fragrances from perfumes, cleaning products, or scented personal care items can trigger symptoms like headaches, asthma attacks, or allergic reactions in some susceptible individuals. So these policies are put in place in order to reduce exposure to potential irritants and to promote inclusivity and comfort in public or workplace environments. Question 19. Calcium is necessary for A. Healthy bones and teeth. B. Energy. C. Normal red blood cells. D. None of the above. Calcium is a vital mineral that plays a key role in maintaining healthy bones and teeth because it helps to strengthen the bone structure and it plays a crucial role in bone formation. Our answer here is option A, but let's see the other options. In option B, calcium is not directly involved in providing energy. Energy is derived from carbohydrates, fats, and proteins. For option C, calcium is not necessary for the formation of red blood cells. That is majorly iron. Iron is the one that is responsible for the formation of red blood cells. Option D is not the correct answer because calcium is necessary for healthy bones and teeth, and we have that in option A. So that is our answer for question 19. Question 20. What is the wave-like motion of food through the digestive system called? A. Absorption. B. Peristalsis. C. Deglutition. D. Digestion. Absorption is the process by which nutrients from digested food are taken into the bloodstream from the digestive tract. Peristalsis is the wave-like motion of muscles in the digestive tract that moves food along the esophagus, stomach, and intestine. Deglutition is the process of swallowing foods or liquids from the mouth into the esophagus, while digestion is the process of breaking down food into smaller components, and this occurs through both mechanical and chemical processes. So our answer here is option B, peristalsis. Question 21. What is the responsibility of the stomach? A. Physical breakdown of food. B. Chemical breakdown. C. Physical absorption. D. Chemical absorption. The stomach plays a role in the physical breakdown of food, but this function is mainly carried out by the teeth and the mechanical churning action in the stomach. In option B, the primary function of the stomach is to chemically break down food using the stomach acids like hydrochloric acid and the digestive enzymes like pepsin, which breaks down proteins. For option C, while the stomach absorbs substances like water and alcohol, the main function of absorption occurs in the small intestine. While option D, absorption of nutrients is not the primary function of the stomach. This usually occurs mainly in the small intestine. So based on the options we have, the responsibility of the stomach is option B, the chemical breakdown of food using the stomach acids. Question 22. An older person's diet should be high in calcium, protein, and vitamins. True or false? The answer here is true. Calcium for older individuals is very important because it helps to maintain bone health and prevent osteoporosis. Foods that are rich in calcium like dairy products, leafy greens, and fortified plant-based milks are essential. Protein intake should also be higher in older adults to help maintain muscle mass, support their immune function, and their overall health. Protein can be found in lean meats, fish, legumes, and dairy products. These are very good sources of protein. Essential vitamins such as vitamin D and B12 are crucial for older adults in order to help maintain bone health and cognitive functions. So a balanced diet that is high in calcium, protein, and vitamins is important for older adults to maintain health and wellness. Question 23. After a meal, residents with swallowing problems and that need to be fed are A. Returned to bed, B. Given a bath, C. Kept in the semi-fowler's position for 20 to 30 minutes, D. Encouraged to exercise. It is not advisable to return a resident with a swallowing problem to bed after eating because lying flat immediately can increase the risk of aspiration or choking. It is also not appropriate to give a bath right after a meal, especially for individuals with swallowing issues. After a meal, residents with swallowing problems should remain in a semi-fowler's position for 20 to 30 minutes because this will help to prevent aspiration and it will also aid in digestion. Physical activity right after a meal can interfere with digestion and it can also increase the risk of complications for individuals with swallowing problems. So, option C, keeping them in the semi-fowler position for 20 to 30 minutes is recommended in order to help prevent aspiration and also to aid in digestion. Question 24. A medical device used to measure fluids is called A. Spirometer, B. Stethoscope, C. Sphygmomanometer, D. Graduates. A spirometer is a device that is used to measure lung capacity or airflow. It is not used for fluid volume. A stethoscope is a tool that is used to listen to internal sounds like the heartbeat and the lung sounds, but it is not used for measuring fluid. A sphygmomanometer is a device that is used to measure blood pressure, but not for measuring fluids. A graduate, on the other hand, is a medical device used to measure fluids, and it is typically used for measuring the volume of liquid in milliliters or liters. It is also referred to as a graduated cylinder or a measuring cup in clinical and laboratory settings. So our answer here is option D. Question 25. Good nutrition is needed for A. Growth, healing, and maintenance of bodily functions. B. Maintaining body functions and decreasing peristalsis. C. Preventing disease and decreasing heartburn. D. Maintaining body temperature, sleep, and relaxation. The answer we'll be going with here is option A. Good nutrition is essential for growth, healing, and maintenance of bodily functions. The nutrients from food supports the body's energy needs, helps to repair tissues, and also ensures that the body's system function properly. This brings us to the end of the Module 6 video of the NACC-PSW certification exam. Don't forget to like, comment, and share, and also hit the subscribe button so that you'll be informed when our next video will be dropping. Thank you for watching this video, and I'll see you in the next one.